There's been a lot of talk lately about Christiana's transformation. What really entailed the procedure? Even though I heard all kinds of procedures, most commentators though mentioned a deep line facelift. And while it's not my style to speculate on celebrities, this case is full of misinformation. So let's clear it up, not to gossip, to educate. Yes, she likely had a deep line facelift, and from my experience, the only technique that delivers this level of definition, the lower face. For precision, the deep tissues, not just the skin, restores useful volume to the mid-face. Exactly what we see here. But the most striking change is her neck, the area under her jawline. Before surgery, there was a visible fullness beneath her jawline, soft tissue protruding, blunting the angle between chin and neck. And when she lowered her face, deep horizontal skin folds formed, a typical sign of aging where skin laxity causes the neck to lose all definition. That dramatic submental cervical angle everyone is noticing, that's not from a facelift. That's the result of a deep neck lift. So what is that exactly? Deep neck lift goes beyond tightening the skin. It addresses the entire foundation beneath, deep fat located under the platysma, tightening the platysmal muscle, sometimes even removing smaller muscle under the chin, and if needed, reducing the submandibular glands. It sculpts the area under the chin and along the jaw, giving that elegant, youthful contour everybody notice, really understands. Another game changer that led to her amazing results, and I'm surprised that nobody seems to have noticed, is that Chris clearly lost weight before her surgery, whether naturally or medically with help of Ozempic or Mounjaro. Look at her now, waist, arms, and shoulders are noticeably slimmer, tiny. So it's obviously also her face, small and defined. She probably has now the weight she had in her 30s and 40s. Being at your optimal weight, slimming down before surgery makes a huge difference when it comes to the quality of the results after a facelift. A face and neck lift always performs better on a patient who is near the optimal weight. So yes, the deep line facelift gave her the refined lower face and restored contour of the jawline. But the most striking and visible effect gave her the deep neck lift. It created the sharp neck angle and youthful profile. In combination with the weight loss, both procedures transformed the look. But the results aren't surprising. This is exactly what we aim for with the properly performed deep line facelift and deep neck lift. Chris doesn't look different, but as young as she looked when she was in her 40s. Looking more than 20 years younger, not different after facelift, is a great achievement. But for sure, slimming down before the procedures contributed to this beautiful result. In the end, it's not magic, it's modern surgical technique performed with purpose.